It's been a tough road for all of us. We hope your road leads you here to Brownsville. Our city's beauty awaits. Explore our great outdoors, embrace our rich history and culture, enjoy our first-class restaurants and shops. We are ready to welcome you. Open skies, open businesses, open hearts. We love this city, and you will too. Begin your planning at visitbtx.com.
We Earthlings have always been an adventuring people. We've always looked to a frontier to give us new opportunity, free rein to our sense of enterprise. The colonization of space offers us a new, limitless frontier. It's bountiful, it's friendly, and it's waiting for us.
One of the most exciting projects in the solar system.
An event that could change the world as we know it.
This is above average stuff.
Coffee's been acquired. Time to go.
With so much happening in space, in the US and around the world, we're building a state-of-the-art global newsroom to cover it all.
Uniquely original content that keeps us connected to space and each other.
Greetings, residents of Brownsville. This is Michelle Jones, the city's epidemiologist, and as part of the Give Me Some Space event, we are going to discuss babies in outer space, pregnancy, breastfeeding, childhood development, not only in space, but possibly on another planet. And to discuss that, I brought along Dr. Will Fernandez, and he's with the University of Texas Medical Branch. He's an emergency medicine physician, and he is currently completing an aerospace medical fellowship. So, this is Dr. Fernandez, and would you like to tell us a little bit about yourself?
Sure. Thanks so much for having me here. Really appreciate it. It's a really exciting topic to talk about. Quick little background about myself. Again, I'm Will Fernandez. Just call me Will. I grew up in Chicago, went to med school in Illinois, did an emergency medicine residency at University of Maryland, shock trauma, have the scrubs on still. And then, like Michelle said, I'm doing an aerospace medicine fellowship with University of Texas Medical Branch in Galveston and with NASA.
So one of the things that really fascinates us are the outfits. So we know that there are set sizes that astronauts go up into, and one of the things that we were wondering is if a female becomes pregnant, what will happen with her outfit?
Sure.
Because her belly is growing, and also after the delivery, there's still a little bit of residual weight.
Yeah, absolutely. Mm-hmm. So the suits that we build, that NASA builds, a lot of the other companies build, they're built to do a couple different things. So when you go to space for any significant period of time, whether it's a couple weeks, getting longer, your height changes. So let's say you're 5'3", 5'4" when you go into space. Well, if you're up there for 6 months, you might grow an inch because your spine elongates. Spine elongates because there's no gravity kind of crushing you down towards the ground, so it gets a little bit longer. And the taller you are, the more you grow in space. So the suits are designed to be able to expand just a little bit at least in the vertical direction, to account for somebody getting taller in space. In terms of somebody getting pregnant and having a belly growing, that's an entirely different thing, right? You can build a suit that grows up 1 or 2 inches, but to build a suit that can kind of withstand a belly growing, that's a very different thing. So what the current plan for something like that would be, you wouldn't have a spacesuit that allows you to go outside with a belly like that. The vast majority of the time when the astronauts are inside the space station or the capsule, they're not wearing the full spacesuit. They're in normal, comfortable clothing that lets them to get their work done. And normal, comfortable clothing allows your belly to expand. So there's no plans that I'm yet aware of to design a specific suit to help be able to expand a developing baby. So majority of the time, you're in your comfy clothing. If you're going outside, you need a very specific suit that be built to designed to expand for the baby's belly, for the belly. We don't have anything like that yet.
Okay. And just piggybacking off of that, a pregnant woman probably would not exit the spaceship or the International Space Station or something of that nature.
Yeah, so when we do something called like an EVA, which is an extravehicular activity on the space station, that's when people go outside the space station in the suits. You see those awesome pictures with people taking selfies, you see the Earth behind them. Those are extremely complicated, high-risk tasks that can take anywhere from 4 to 8 hours or sometimes even longer. And it's a huge undertaking when that happens. And we try to minimize the risk of the person who's going out there, the medical risk, the engineering risk, all levels of risk. And if somebody's pregnant, they inherently have a higher risk of a lot of different things. Not that it's a bad thing, but you just have a higher risk. That's the way it goes. And so we would not put a woman who is currently pregnant outside the space station for a lot of different reasons. One, because it increases the risk, like I talked about, but also something we'll talk about a little bit later is the radiation. If you're outside any of the space vehicles we have or outside the space station, the radiation is even higher. There's no protection from the vehicle itself, and radiation and babies don't go well together. So.
Oh, fantastic. That's good information. One of the things that we currently battle here on Earth is severe maternal morbidities. And I was wondering if those would increase in a low gravity or zero gravity atmosphere.
Sure. So that's a very difficult question. There haven't been a lot of studies that we've done specifically. We haven't obviously put pregnant women in space. So a lot of what I'm about to tell you is what we've kind of rationalized what we think will happen based on our understanding of the physics, understanding of medicine in this type of environment. So on Earth, there are all kinds of things that can increase morbidity, right? You don't want to be getting a whole lot of CT scans if you're pregnant, because that's, again, more radiation, which we talked a little bit about. And in space, there's even more radiation. The microgravity environment in itself causes all kinds of changes on the human body. Your torso and your head kind of expand a little bit in space because the fluid in your legs moves up into what we call the interstitial tissues, which is the tissue between the muscle and the fat. So a lot of those tissues, they fill up with fluid. So a lot of people in space, if you see pictures of them on the International Space Station, their faces are very round, much more round than Earth, because the fluid's just kind of pulling. And if somebody's pregnant, they have a little bit more fluid in their body, and so that could increase the amount of pooling in different places. Over time, some individuals, their vision changes in space, and so you have a pregnant woman now who's dealing with these fluid shifts. The vision could be changing. You get a lot of back pain in the first few days that you're in space because your spine starts to elongate, and that causes a lot of pain. You get really nauseous right when you first get to space because your vestibular system, which is your balance system, kind of helps you just maintain balance. You get to space, there's no gravity pulling you down, and your vestibular system is thrown all out of whack. So you get really nauseous, sometimes people throw up, and if you combine that with something like morning sickness, well, they're going to be throwing up even more. And nobody likes throwing up in space because it doesn't just go into a bag and stay there. It literally floats around unless you catch it in a bag, hopefully. So it's one of those things that kind of gross, but we try to manage the best we can. So there are a lot of different things just about being in space in general, not even on another planet, just being in space in what we call microgravity, which is the same thing as saying zero gravity. A lot of things about zero gravity that increase the risk to the mother. And that's another thing that we're working on studying that. But like I said, we haven't sent actual pregnant women into space. We have looked at things with rats, have looked at things with mice a number of decades ago, actually. And it seems to be the rats and mice, they can carry the baby all the way to term. In part because when a baby's inside the woman, baby's already floating in a bunch of fluid. It's basically underwater in a pool, and it's kind of like space already. The only strength training a baby gets is when they push against the uterus. When you see the mother's belly moving, that's the baby just kicking and pushing. And that builds some of the muscles for the baby. The baby will still have that kind of training in space because they're still floating inside the belly, they're still pushing against the belly. Not much has changed there. So from a microgravity perspective on the baby, not too many changes. But microgravity perspective, on the mother, lots of changes that we're still trying to work out the kinks of.
Oh, that's fascinating. Thank you. So just moving on, since we are talking about some of the morbidities, one thing that is always kind of scary is if you have to have a cesarean or often termed C-section in some of those areas, and what happens to the blood and the fluid, because it's not a clear-cut, real easy process to go through.
Yeah, surgery in space is always a very difficult topic. When you have microgravity, things floating around all over the place, if somebody starts bleeding, well, the blood doesn't just pool on the arm, it'll keep on going and float into the room, and you have to catch that, you got to suction it up, do something with that. One of the concepts that's been talked about to kind of reduce the likelihood of that happening is during any surgery that could be performed in space, whether it's a C-section or taking out an appendix, something else, what you could do instead is you could turn on your engine, turn on your thruster just for a little bit to reproduce some of the gravity that would be on Earth. So let's say if Earth is 1 G, 1 gravity, we would instead have 0.25 Gs or 0.5 Gs. And that would cause just enough gravity to make all the blood that comes out, any fluids, amniotic fluid, to pool in the right place, and we can suction it up and not cause a problem. That does have some caveats because you need to bring more fuel with you, and bringing more weight into space is always more expensive, more difficult to do. But that's one of the ideas that's been talked about. In terms of performing a C-section in space to begin with, on Earth, a lot of C-sections are done electively, like a mother chooses a C-section and that's performed. That does have slightly increased risk to the mother. So in space, the option to do a C-section electively likely would not be an option. We would only do a C-section if it was absolutely medically needed, medically warranted, because it increases risks, it uses a lot more resources, and just is a whole other thing to worry about than just doing a normal vaginal delivery.
So one of our colleagues actually asked this. So you perform the cesarean section, and would the baby float out?
So technically, when you do a C-section and you get into the uterus and you pull out the baby, if you were to pull out the baby and just let go, the baby would just stay there.
Yeah.
And kind of slowly rotate depending on, if you let go with your hand spinning like this, baby will continue to spin a little bit. Baby will just stay there, floating in the air. If you do the incision for a C-section, baby isn't just going to pop out and float away. You still have to pull out the baby. But yeah, technically the baby will just float around in the middle of the room.
That's really fascinating. One thing that we also mentioned, and I'm sure the technology, if we anticipate having women pregnant, you're going to have a lot of equipment and stuff. What would be some of the ramifications if we have a possible birth defect with the baby when it is delivered?
Yeah, so definitely that's another huge topic of consideration. When you have a baby who's developing in space, let's say a woman gets pregnant in space. So she spends the whole 9 months carrying the baby from inception to term. And the most likely time for a baby to develop any sort of birth defects from radiation is in the first few months of pregnancy. That first trimester, that's the critical time. If you need to get x-rays or a CT scan during a pregnancy on Earth, if you can wait until you're out of the first trimester, that's the best. So in space, can't really protect from that amount of radiation. We have some methods we can do to reduce the amount of radiation, but there's still a significant amount of radiation, especially when you're going to the moon, or especially when you're going to Mars. Like going to Mars is a tremendous amount of radiation, just going there, not even being there on the surface. And so, because there's this increased radiation risk, there's an increased risk of birth defects. And these birth defects might require some sort of, like you said, additional equipment to manage those things. The consideration for bringing more equipment would be exclusively based on the risk of that actually occurring. Let's say through a lot of calculations and a lot of studies which haven't yet been performed, we determine there's an 80% risk of this specific defect occurring. Well, that's a huge risk. It's very likely to happen. We should bring some equipment to deal with that. So a lot of this stuff depends on what the risk actually is. And for us to figure out what the risk is, we need to do the studies to determine exactly what the risk is. And some of those have been done a couple of decades ago with mice, with rats, but nothing has yet been done on humans. So a lot of what we know is based on our understanding of the physics, or our understanding of the medicine, and going from there.
Okay. Have any primates been impregnated, or have we gone to that kind of level? Are we ready to go to that level where we up the game on the the animal?
Sure. So there's been a lot of monkey studies, definitely on Earth prior to actually going into space. There have been a couple of chimps that have gone to space, but all that was done decades ago, and none of that had anything to do with pregnancy-based studies. And so we've done a lot of mice, a lot of rats. And when I say a lot, it's not hundreds; it's still a small number. So are we ready for the next step? We might be. We might be getting there. There's a lot of engineering problems that we're trying to solve for getting us from here to Mars, or putting a colony on the moon, or putting a colony on Mars. And a lot of steps need to be solved. And one of those steps is, well, we need to figure out what we're going to do with childbirth, with pregnancy, because if you want to have a definitive multi-planetary species like we want to do with humans, well, you need to figure out how to reproduce in space and how to reproduce on another planet and carry that baby to term without any complications.
So as we're talking about pregnancy, we understand that nutritional needs kind of change. So we need more calories because we're growing a human being.
Yeah.
And one question that we have is, are there nutritional issues that we need to be concerned about? The quality of the foods that are up there. I know that they've experimented with growing food. So what would be some of those considerations that we would need to look into?
Sure. So from a nutritional perspective, NASA does a really good job of making sure all the astronauts get exactly what they need and then some. So there's all kinds of scientists that work within NASA, within the food lab. They have an incredible food lab where they make all kinds of foods, and they take requests from the astronauts to make specific food for the astronauts that the astronauts prefer. And they measure all the food in exquisite detail to make sure it has the right amount of fat, right amount of carbohydrates, right amount of calories. And if it was anticipated that this one of the particular crew members was going to get pregnant, well, if that was the plan, they would also include enough calories, enough carbohydrates, enough fats, protein, to make sure that that crew member has exactly what she needs to support the development of a baby. The concern would come into play when there's an accidental pregnancy and now we don't have enough food. Usually the space station has plenty of extra food just in case something happens. Sometimes when we launch a rocket up to the space station, it gets delayed for a week, and because of those expected delays sometimes, the space station has a lot of extra food just in case. For a trip to Mars, the space is extremely limited. Not space as in, space, but space within the vehicle is very, very limited. So bringing extra food, unless it's planned for ahead of time, would be very difficult to do. From the quality of the nutrition, the quality of the food, that would be fantastic. NASA does a great job of making sure everything is included within the food. They even do a good job of making sure it tastes good too. Initially, back during during the Apollo era, the food, it was just exactly what you need without much of a focus on taste. And well, a really good tasting meal does wonders for your spirit. It makes you feel better overall. And so NASA definitely tries to include a good tasting aspect to their food. So from a nutritional perspective, that would all be taken care of.
Okay, that's really great. So one of the other ones that we had talked about is on the nutrition side. What about breastfeeding? Because granted, we're suckling, so there's that suction there, and we would assume that it would just come out. But based on all of the nutritional needs and the extra radiation, would the breast milk be impacted? Because we know that when they create that suction, the mom and baby create this bond where she's kind of picking up what the baby needs and altering her breast milk and extracting nutrients and stuff within her body to make sure that the baby is fed. So with that exposure, with the extra radiation outside of the womb for both mom and baby, would that breastfeeding be impacted?
Yeah, so the radiation, it's a wrench in the machine of all of this. So radiation will definitely affect the breast milk. If it affects the mother, it'll affect the breast milk. In terms of the mechanics of actual breastfeeding in space, that wouldn't be affected whatsoever. Even when there's zero gravity, because for the baby to actually get milk out of the breast, it's that suckling motion, that will still occur without any difficulties. The problem becomes the radiation. And we're still trying to figure out how to ameliorate that risk, reduce that risk. But it's just something we have to deal with for now. In terms of the mechanics of actually breastfeeding, that wouldn't be affected at all.
All right, that's good to know. Just following up on that particular one, because as the baby is growing, the mother's nutritional needs kind of change also. So as you were saying previously, with an anticipated pregnancy, and breastfeeding is the all-time, there's no waste, no extra product that you have to carry, but would they consider including additional meals to accommodate for those fluctuations in what she's providing depending on the particular stage of the baby.
Yeah, so again, a lot of this stuff is at the planning stage, the pre-planning stage. And so if it's breastfeeding also isn't always 100%, right? Some mothers have a lot of difficulty actually establishing breastfeeding. And that's nothing wrong with the mother, nothing wrong with the baby, it's just something that happens. And so NASA wouldn't, I shouldn't speak for NASA specifically, but in general, we wouldn't take a look at, we wouldn't rely 100% on breastfeeding. We would likely include some sort of formula product and include just additional nutrition for the mother overall, just to make sure that she has what she needs to produce the breast milk moving forward. But it's, all spaceflight, there's a lot of focus on reducing risk.
Yeah.
And if breastfeeding isn't 100% guaranteed to be successful, well, we need to have some sort of backup in place to account for that chance of risk.
Okay. So that could even be like nutritional vitamins for the baby or mom, and
combination of all those things.
Yeah. Okay.
And before actually choosing one of those things, they would do studies first to figure out which of those things is the best to do.
Okay, fantastic. And then I hate to conclude, but is there anything that you think that we might have missed that we feel is very important to the to become a multiplanetary species and becoming pregnant and having babies, and maybe things that we should consider if we're on another planet?
Sure. Yeah, so it's all this is extremely exciting. There's a lot of challenges with all of these things, and some people will look at going to space or putting people on another planet or becoming multiplanetary as a challenge that's not worth undertaking, because there are so many difficulties. And why not spend the resources back home when we have all these other problems that we're dealing with? Well, there are a lot of things that have come out of the space race previously. So you've heard of an MRI machine.
Yeah.
We only have MRI machines because of the space race. There's a lot of going to the hospital and getting an EKG done, where they have what they call telemetry, where the doctor in another room can see what's going on with your heart. Well, that came out of the space race. A lot of things came from the space race. And so we don't even know what discoveries we're going to make. We don't even know how society as a whole might be affected by things we develop in the process of going to other planets. So that's one huge reason to keep pushing for this. These are important conversations to have because they lay the first steps and help us come up with more questions that we need to answer before we actually undertake it, to make sure the women that go into space and get pregnant, make sure they're safe, the babies are safe, that overall the entire crew and the mission isn't affected.
So you've triggered tons of new questions. This can go in so many more directions. So I want to, again, thank you for being here and informing us about all the interesting things, and I'm sure we're going to have tons more questions, especially as we're on the cusp of moving forward and completing our next evolutionary jump.
It's a great time.
So if you found this conversation fascinating and love the topic of space, remember we have the Give Me Space activities and programmings, and if you want to find those, visit btx.com for all of those activities. And we're going to go ahead and sign off. My name is Michelle Jones, the city's epidemiologist.
I'm Dr. William Fernandez.
Reminding you, live long and prosper.